welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. It is very stressful for us as an adult to end up in emergency room for medical emergencies, but it is much more stressful for parents to take their kids to emergency room when they are sick and they have emergencies. But the good thing is that now we have emergency room physicians that they are trained in pediatric emergencies. So we have invited Dr. Hasmig Jinivizian, who is specializing in emergency room as well as pediatric specialty in emergency room. Dr. Jinivizian, welcome to our program.
Thank you.
What are the most common conditions that we see in emergency room as pediatric emergency room?
I will say that among the medical conditions that we see, difficulty breathing and abdominal pain are some of the most common things. Among injuries, we see extremity injuries like bumps to the arms or the legs, but a lot of head trauma. A lot of injuries to the head in all age groups.
And a lot of viruses, right? A
lot of viruses
that we have, common upper respiratory infections, probably they come in for
That's right.
at night,
That's
ear
right.
infections.
That's right, ear infections and viruses are quite
Right.
common.
So let's take one subject at a time. Let's take the head trauma.
Okay.
So let's, what kind of head traumas you see?
Many of the head traumas that I see in older children and teenagers are related to sports, sometimes also related to motor vehicle collisions, but those are often related to sports. Head injuries in the younger children I often see from toddlers running around and falling and hitting their heads.
What are the signs and symptoms that we should tell the parents that you should be looking for, that it's important to bring the child to emergency room right away?
That's a very good question. Some of the things that are warning signs for a serious injury to the brain could be not acting like their normal self. So if the child is acting extra irritable or fussy, sleeping excessively, those can be signs of a serious trauma.
Not eating enough, probably, or not feeding?
Not
for the
feeding.
babies even?
Yes, for babies, certainly not feeding. Absolutely. Another thing to keep in mind of is not only not feeding, but whether they're vomiting. So a couple of episodes of vomiting is okay, but if they're vomiting more than 3 times, that's generally concerning. We also think about loss of consciousness to a degree. It's not uncommon for a child to lose consciousness very briefly after a head trauma, but if they've been unconscious for more than a few minutes, that's certainly a reason to come to the emergency department.
When is it time for CAT scan in emergency room? Because now there's a head trauma, and the family, even though you might say, well, kid looks all right, that you can take the kid home and observe those things, but they might be very anxious if a CAT scan is not done. What do you say for that? We
take CAT scanning very seriously because it's an exposure to a lot of ionizing radiation. A CAT scan of the brain is the equivalent of getting 80 to 100 x-rays, so it's not insignificant.
How about the adults? Let's talk about the teenagers that they have sports injury. Head trauma probably is the same as the children, but how about the neck injuries, the knee injuries? How often do you see those? So
with any head trauma, we always have to assess for a neck injury as well. One of the common things that we may see is what we call a stinger. So in some sports like football, where they have an axial load or a hit directly onto the head, they can sometimes have a brief
electricity coming in, actually.
Yes.
They feel that way.
Yes. An electricity sensation in their hands, sometimes weakness of their arms, sometimes persistent numbness or tingling in their arms. And this is because of a brief twisting of the spinal cord that may happen at that time.
Right. So that's trauma section that we see. Now let's go to viral syndrome that children come in, especially young children come in with fever, wheezing, not breathing well.
Yes. This is a very common complaint, especially in the winter. Young babies especially in the winter season are prone to getting viruses that may cause them to wheeze. In older children, they may have a typical runny nose, cough, or congestion, but because their lungs are so little, they get something called bronchiolitis, which is an infection of the smaller airways of the lungs.
It's a viral infection.
It's a viral infection. So unfortunately, antibiotics won't make it any better. In fact, not much medicine does make it better. We have to suffer through it until the child's body can heal itself on its own.
How about cortisone in this situation? in the past we used, but then recently
Yes.
I read that, okay, cortisone is not really
Yes.
doing the trick that we wanted.
That's right. The guidelines have changed in that no matter what medicine we give, whether it's the albuterol or whether it's any kind of cortisone or steroid medicine, it doesn't alter the course of the virus. It can sometimes make the symptoms a little more tolerable while they're going through it.
Under 2 or around toddler age, at one time I encountered a foreign body aspiration, and it was very surprising for us because the kid came with wheezing, and we thought that it's asthma, and turned out to be a small, actually, marble that the baby, or kid, I should say, swallowed and actually lunged in bronchial tree.
Yeah.
How often do you find the foreign body aspiration that parents should be careful?
This is a major concern because children, young babies, toddlers, like to explore the world with their mouths. So everything goes in their mouths, as any new parent realizes once their child begins to develop those motor skills. So you want to make sure that your home is free of any small objects that can get lodged in the child's airway.
How about asthma? Now that's a common problem, and usually we see in the office too. What is asthma exacerbation in the emergency room? What do you do?
Well, we typically, as in any case, we want to rule out other conditions first. A lot of people are familiar with asthma, they're familiar with their wheezing, and they can tell you that this is very typical of their asthma. In those cases, when you feel confident that asthma is truly the culprit, you would start initiating a course of breathing treatments involving what we call bronchodilators, which open up the airways and allow more air to get in and out of the lungs, as well as steroid medication.
Now it's indicated.
That is definitely indicated,
right.
and can be life-saving.
What other conditions that they come in, the kids especially, children, young babies probably, or toddlers with fever?
By and large, the vast majority of fevers in children and toddlers, especially if they've had all of their vaccinations with the pediatrician or their family doctor, are viruses. These can range from the common cold to the flu. Now, there are some tests we can do to distinguish between the common cold and the flu, but these are not usually necessary in most situations. And, you know, a lot of parents have a lot of fear and anxiety about fever.
But actually fever is a defense mechanism. It's very healthy actually. It's healthy in a way that baby is responding with the immune system.
That's exactly right. A fever is the body's natural response to fight off infection.
What would the recommendation that mothers, parents should have at home? Should they put dehumidifier or humidifier in the room? Is there any recommendation for that?
Yes, especially with a cold or a flu, when they have a lot of nasal congestion and coughing, it does help tremendously to have a humidifier in the room at nighttime. Nowadays, I think we're going more towards the cool mist rather than the warm humidifiers. I think either one is probably okay. And it's always important to use distilled water if you're going to use this at home.
Distilled water for the
Yes.
humidifier. Dr. Jinivizian, thank you very much for coming.
You're very welcome.
Our time is over, and then we'll continue in the next program.
Thank you.
Now it's time for this week's article, Effects of Egg Consumption on Health. Dietary carotenoids like alpha and beta-carotene, lutein, zeaxanthin have protective effects on age-related macular degeneration, cardiovascular disease, and some cancer. We get carotenoids from fruits and dark leafy green vegetables. Dietary guidelines recommend the consumption of 4 to 5 cups of vegetables and fruits a day. Fat is necessary for absorption of carotenoids from fruits and vegetables. For example, healthy young adults had 3-fold increase in alpha and beta-carotene absorption when they consumed a salad with full-fat dressing compared with fat-free salad dressing. Eggs are high source of lutein and zeaxanthin and increase the intestinal absorption of carotenoids. Avocado is also a source of good fat and increased carotenoid absorption from fruits and vegetables. Recently, a study supported by INH assessed the effects of egg consumption on carotenoid absorption from raw mixed vegetable salad. Healthy youngs were given mixed vegetable salad either with canola oil or with 3 eggs, and the blood samples were collected to measure all carotenoids. Carotenoids were 3 to 8-fold higher with 3 eggs added mixed vegetable salad compared to canola oil salad. Consuming cooked whole eggs in an effective way to enhance carotenoid absorption from fruits and mixed salad vegetables. Consuming carotenoid-rich food is the best way to prevent age-related macular degeneration, cardiovascular disease, and some cancer. Add eggs to your salad and use olive oil with vegetable salad. Do not use fat-free salad dressings. Use olive oil-based salad dressings, or use lemon and vinegar and add eggs and avocado to your salad with mixed vegetables. Good health is precious and priceless. Pay attention to your health and keep informed by visiting AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.